In today's presentation, we'll see about Garre's osteomyelitis. First of all, we should know the basics about osteomyelitis. The word osteon means bone, melanos means marrow. So osteomyelitis refers to the inflammatory process in the medullary spaces or cortical surfaces of bone. So osteomyelitis is usually caused by infections which spread through the bone, and it is usually a sequelae of pulpitis. So any infection in the pulp can lead to pulpitis, which in turn spread to the apical region, causing apical periodontitis, which in turn can cause periapical abscess or periapical granuloma. When the infection spreads from the periapical region and reaches the bone, it can result in osteomyelitis. And the further spread of infection to the periosteum causes periosteitis, which in turn spread to the soft tissue, causing cellulitis or abscess. So the pathogenesis of osteomyelitis is that the infection and inflammation in the bone and bone marrow can lead to pus accumulation. The pus then spreads to the vascular channels, which raises the intraosseous pressure and impairs the blood flow in that region, resulting in chronic ischemic necrosis. As a result, there is separation of large devascularized fragment, which is called as sequestrum. And there is also new bone formation around the area of necrosis, and this is called as involucrum. So now we'll see about Garre's osteomyelitis. So this is a distinctive type of chronic osteomyelitis wherein there is thickening of the periosteum. Hence, it is also called as chronic osteomyelitis with proliferative periostitis or periostitis ossificans. So here there is more of peripheral reactive bone formation, and this reactive bone formation usually results from a mild irritation or mild infection. Whereas in other types of osteomyelitis, as we saw in the previous slide, there is necrosis of bone due to impaired blood supply and there is bone destruction. Whereas here in Garre's osteomyelitis, there is more of periosteal bone formation, reactive bone formation, and it is caused due to mild infection or mild irritation. So these are the unique features of Garre's osteomyelitis. That is, it is there is in this type of osteomyelitis there is proliferative subperiosteal reaction, and it commonly affects the developing skeleton. So usually children to young adults are commonly affected, and as I told before, it is as a result of mild irritation or infection. So this periostitis ossificans or Garre's osteomyelitis is increasing nowadays. This could be due to the increase in the standard of living, which has resulted in more of anabolic response rather than a catabolic response. That is more of bone formation rather than bone destruction, and due to increased use of antibiotics, which affects the virulence of the microorganism, thereby the osteolytic process is turned into a osteoblastic process. The common cause for infection and inflammation in the bone and bone marrow is due to the spread of infection from dental caries with periapical inflammatory disease, or due to spread of infection from the periodontium, or due to fractures, buccal bifurcation cyst, or any non-odontogenic infections. So this reactive periostitis, it may develop as a result of central dental infection of the jaw, which perforates outwards, or it can also be due to a result of overlying soft tissue infection or cellulitis, which spreads to the periosteum, resulting in reactive periostitis. So clinical features, it commonly affects the children and young adults, usually before the age of 25 years, and anterior surface of tibia is frequently affected, and in the oral cavity, mandible, especially the bicuspid and molar region, is commonly affected. Maxilla is seldom affected, and the exact reason is not known. So the patient will come to a dentist with a complaint of toothache or pain in the jaw, along with a bony hard swelling on the outer surface of the jaws. Intraoral radiograph will often reveal the carious tooth adjacent to the bony mass. Here in this radiograph, you can see it's a radiograph of an 8-year-old boy who presented with swelling in the left lower mandible, and IOPA was taken, and we can see the presence of large periapical radiolucency associated with the permanent first molar, and associated with the, especially with the mesial root of the first molar, and previously pulpotomy was done for this patient. And when occlusal radiograph was taken, we can see the classical onion skin appearance, which is the focal overgrowth of the bone on the outer surface of the cortex of the bone, and it is described as the duplication of cortical layer of bone. So this is a classic feature of Garre's osteomyelitis, wherein in the occlusal radiograph, the onion skin appearance is seen. When when histopathological examination is done, we can appreciate the subperiosteal new bone formation. So this is the reactive woven bone formation with the bony trabeculae, which are arranged in parallel to each other, whereas perpendicular to the cortex. And this arrow mark, it indicates the granulation tissue present here. When viewing under higher magnification, we can see that osteoblastic rimming is seen around the bony trabeculae, and the connective tissue, we can see that it is there is a fibrovascular stroma with a scanty inflammatory infiltrate. So usually the treatment is the removing the cause. So either endodontic therapy can be done or extraction of the offending tooth can be done. And we can see that in the previously seen radiograph, we can appreciate that after treatment, the lesion is completely resolved. And the differential diagnosis. So this periostitis, the periosteal reactive bone formation is also seen in other conditions like infantile cortical hyperostosis or Caffey's disease, hypervitaminosis A, syphilis, leukemia, Ewing sarcoma, metastatic neuroblastoma, and fracture careless. So a care must be taken to exclude them from the diagnosis. Thank you.